Hi everyone, my name is Yishuan and we are Group 3. Today we'll be discussing a case study which involves Katie, a 35-year-old woman who was just confirmed to be pregnant. However, she's worried about possible miscarriage as she has had 2 miscarriages last year without known causes. In this presentation, we'll discuss the possible cause of her miscarriage and what she can do to ensure successful pregnancy this time. These are Group 3 members, and this is an outline of our presentation today. As both Katie and her husband are healthy adults and have been living a healthy lifestyle, the cause of her miscarriages were obscure. Furthermore, she did not conduct any additional tests at that time to investigate the possible reasons for her miscarriage. Our group came up with several hypotheses that could explain her miscarriage. These hypotheses include advanced maternal age, where it is well known to cause miscarriage. It could have been also due to because Katie's body wasn't recovered from the previous miscarriage before having another baby. Another hypothesis was the attribution by genetic abnormalities such as abnormal embryonic karyotype. Lastly, our group also included blood grouping as another hypothesis. I'll now pass on the presentation to Xiaobin.
In the case study, the possible reason for Katie's miscarriage could be attributed to Rh incompatibility. Rh antigen, often called the Rh factor, is an inherited protein found on the surface of red blood cells. Among all the distinct Rh antigen identified, the primary Rh antigen of concern is Rhd, which can cause the most severe immune reactions. In the context of Rh blood group system, individuals are clinically classified into Rh positive or Rh negative based on the presence or absence of the Rhd antigens. Individuals with at least one Rhd alleles result in a Rh positive blood type, while the absence of Rhd antigens is associated with Rh negative blood type. Theoretically, there are two possible scenarios that lead to Rh incompatibility. In scenario 1, if Katie's have two recessive alleles and her husband have one dominant alleles and one recessive alleles, there's a 50% chance the baby will inherit the dominant Rhd alleles from the father and be heterozygous Rh positive. While in scenario 2, if Katie's have two recessive alleles and her husband have two dominant alleles, there's a 100% chance the baby will inherit the dominant alleles from the father and be heterozygous Rh positive. Next, I'll pass the floor to Carlo.
Thanks, Chalvin. I'm Carlo, and I will now talk about the immunology behind the rhesus incompatibility. In the first pregnancy, rhesus incompatibility does not occur. The mother's body lacks memory B cells against the rhesus antigen or D antigen. When the mother's blood mixes with the fetus rhesus positive blood, her immune system recognizes it as foreign and produce antibodies such as IgG in the first pregnancy. However, the antibodies produced during the initial encounter with the D antigen are relatively low and generally did not harm the baby. Additionally, memory B cells against the D antigen are produced and stored in the mother's body, preparing for future pregnancies. The onset of rhesus incompatibility typically begins in the second pregnancy. When the mother carries a rhesus-positive baby in a subsequent pregnancy, her immune system becomes sensitized. Memory B cell will release antibodies to attack the baby's triple cell that have the D antigen on their surface. These antibodies, specifically IgG, cross the placenta and target the fetal red blood cell. The binding of IgG antibodies to the rhesus antigens on the fetal red blood cell leads to their destruction by the immune system, a process known as hemolysis. Another important mediator in the immune system is the complement system, which comprises of a group of proteins that can help destroy the foreign cells. In the context of rhesus incompatibility, the IgG antibodies bound to the fetal red blood cell can activate the complement system, further contributing to the destruction of the red blood cell. However, it is important to note that hemolysis of red blood cell does not always result in a fetus death, and the fetus may still be able to be give birth successfully. Next, I'll pass it on to Naila and Simita to explain about the pathology. Thank you.
In a subsequent pregnancy, if the baby is Rh positive, there is a possibility of a condition called hemolytic disease of the newborn. What happens is that the antibodies of the body produced during a previous exposure to Rh positive blood can cross the placenta attached to the baby's Rh positive blood cells. This immune system reaction leads to the breakdown of baby's red blood cells, a process called hemolysis. Consequently, the baby starts to accumulate bilirubin, a pigment formed when hemoglobin breaks down, which causes jaundice. Jaundice is therefore characterized by the yellowing of the baby's skin and eyes, indicating elevated levels of bilirubin in their bloodstream. Now, on top of that, the hemolytic disease of the newborn can also result in the various degrees of anemia. When the levels of hemoglobin in the red blood cells and the baby's blood falls below normal, anemia occurs. The signs of anemia in newborns may include pale skin, lack of energy, and difficulty getting adequate nutrition. It is important to remember that during the first pregnancy, the B cells retain a memory of miscarriages previously, which triggers the immune response that can impact future pregnancies and can lead to several complications such as liver failure, heart failure, chromosomal abnormalities, immune system dysfunction, genetic abnormalities, chronic inflammation, and sadly, even stillbirth. That's all for the pathological causes and symptoms, and now I'll pass it on to Simit.
Thank you, Naila. Now I'll be speaking on the diagnosis and possible treatments. So for the diagnosis, the first one would be the blood test. So this helps to know the blood type and screening for any antigens that may cause unsuccessful pregnancy. Then using these results, the health professions can proceed to find treatments required. So the next will be the Combs test. This test aids to check your blood for antibodies that attack your own red blood cells, which usually causes a miscarriage. Lastly will be the Rh antibody screening test. The Rh antibody screening test is a blood test that checks your blood for Rh antibodies. If you have any Rh negative blood and have been exposed to Rh positive blood type, your immune system will make antibodies to attack the Rh positive blood, which when it comes to pregnancy, it is the reason why most miscarriage is occurred. So when a pregnant woman has these antibodies, it is called Rh sensitization. Next, I'll be speaking on the possible solutions. So first, we'll be having an injection of anti-D immunoglobulin RhOGAM. This helps to neutralize the Rh. This will be done routinely in the trimester of the pregnancy as a small amount of blood is passed into the mother's body. If the baby is Rh positive, the mother will get a second injection within few days after delivery. So this injection prevents development of antibody against Rh positive blood. So the next one will be the bilirubin light. Infants with mild Rh incompatibility may be treated with phototherapy using bilirubin lights. IV immunoglobulin may be also used. So for the infants severely affected, an exchange transfusion of blood may be needed. This also decreases the level of bilirubin in the blood. So lastly, for a successful pregnancy, regular prenatal care is required, which provides the clinicians to provide the best care to have a successful baby to be delivered. Thank you.
Thank you, Simita. To conclude our presentation, we have found that Kathy has been having miscarriages due to rhesus incompatibility with her baby. This is due to her husband being rhesus positive, resulting in either 50% or 100% of heterozygous rhesus positive fetus. There are several possible solutions to ensure Kathy's pregnancy is successful this time, as she has identified the root of cause to her miscarriage. That is all from Group 3. Thank you.